Right. Hi everyone, welcome. My name is Ayodele and I am CEO at PneumaCare. During the course of this, I will definitely explain what PneumaCare is and what we do. Um, this is a monthly webinar series that we do. We've called it Adopt AI, but I think that's AI there is because that's probably like the coolest thing you can be doing right now. But beyond that, the goal really is actually to explore conversations largely around health systems in Africa and how, technology can gain faster adoption. Many years ago, the conversation really used to be more around, what technologies can we build or could we build? Today, we see a lot of people building technologies, especially post-COVID. And the biggest problem that we see is the adoption of those solutions. Some typically would go through the route of trying to sell directly to hospitals and patients. And some goes a different approach, which I like to call the program-led innovation approach. And we've seen different results over the years. So the conversation today really is to explore, how digital public goods, DPGs, and open source could be potential viable models for startups or innovators within the digital health space, generally across Africa and even beyond just healthcare, general IT solutions as a whole to see how they might be able to gain adoption. And within the scope of that conversation, we're talking largely around government perception for adopting open source or digital public goods. And I think Bolaji's experience advocating and engaging with governments in that regard would actually be very useful for us. On the other hand, is really exploring conversations largely around like, how do we drive trust? Many years ago, open source was not cool, right? It was something that people felt wasn't secure enough, had very low skill, sustainability and could not scale as much as people wanted it to be. Even though it was running and powering a big chunk of the technologies we used at the time. But the public perception wasn't necessarily great and across organizations and institutions. So a big part of this is also just, exploring how and just learning how to enable what I call like institutional trust for open source technologies. The third part of this is actually, how do we guarantee sustainability? If you are exploring open source and or digital public goods, what are the potential opportunities for sustainability? Given that you moving that approach means that you're agreeing to not charge money for a big chunk compared to like your counterparts trying to build proprietary solution. On the call today, we have, two great friends of mine. Bolaji, who is a DPG evangelist and works largely with, with Digital Public Goods Alliance. Prior to that, as I spent a lot of his time, doing open source advocacy. I'm not gonna do the introduction for him. He's gonna do it eventually, himself. And on the other hand, I have Tosin. Tosin has been my friend for I think about 10 years plus now. And, we used to work together in a different healthcare organization. And now he leads engineering and manages everything engineering at Helium Health. Helium Health is, I would say, the highest, the most funded health tech company in Africa. To the best of my knowledge, right now, they build EMR, they have EMR platforms and a few other services that they provide to healthcare facilities. They are not open source, but I know they also interface a lot with, have conversations with clients who are considering open source. They use some bit of open source internally, and also, just to hear Tosin's perspective with respect to how they manage, this perception generally within the organization and also how they manage conversations with clients that probably would request or ask why not use an open source alternative in their regard. So this is supposed to be a 1 hour conversation. At the end of the day, depending on how many people we have on, I like to do a virtual networking session. And the goal really is actually that you can meet someone else that is doing something cool at the end of the session. It's not salesy in any sense. We're not trying to get you to sell or find money. So I don't have any investor on the call. So, but the goal really would be that, we can try to network, share, at very least share LinkedIn profiles and share the link to what you're building and see if there are potential opportunities for collaboration. Yeah, so that's it. Like I said again, PneumaCare is powering. I mean, PneumaCare is the front for this. We have a sister company called ISPA, HSMA. HSMA is a healthcare. I mean, so we're a healthcare solutions market and analytics platform. A big part of what I've done over the last few years has been trying to find adoption for digital health products. And what ISMA does here is it provides this directory that allows for program teams and IT buyers across healthcare institutions to find digital health products that they're looking for. They can explore the options that they have. They compare those options, and lastly, we then use all of the data that we have in terms of search patterns and criteria to actually then inform product teams in terms of insights that allows them to build better products and shortens the path to adoption. On the other side of that is we also have a network of implementers across multiple countries that you can then easily partner with to help you deliver a solution to partners in new markets as you continue to grow, which then means you can grow faster, you can gain faster adoption, and your journey to the market is shorter. Um, that's it. Again, like I said about PneumaCare, we started in 2020. We've, raised some bit of funds from Founders Factory Africa, now called 54 Co, Pantemis Limited, and a few other angels. We do a lot of work around program-led growth model for healthcare, which means that, we don't necessarily try to sell our software to hospitals. We've tried to do that in the past, but now we partner more with like, ministries of health, and we partner with like non-profits that are working with populations that have scale, and then they can help us drive adoption for our solutions. So that way we can balance the high cost of acquisition with the low willingness to pay within the market as much as possible. Happy to chat a lot more about this. We're doing a lot more work over the next few months to make this come to the fore. And we'll keep everyone posted as much as possible. Now to the conversation. I'm just gonna leave to Bolaji to introduce himself, and then he would pass the baton to Tosin. Again, thank you very much for being on the call. Such a huge pleasure to have you, and looking forward to this conversation. Hi, Bolaji.
Uh, Ayodele, thank you very much. I'm happy to be here and also to see some familiar faces. My name is Bolaji Ayodeji, and I'm the DPG Evangelist and Technical Coordinator at the DPGA Secretariat. It's a bunch of words. Sometimes it's annoying having to spell it out long, but I'm mostly responsible for our work with GD Public Goods and the product owners behind that, the entire assessment process. We have a DPG standard. We have a DPG community likewise also. So I just leave it there. My background is software engineering. I've spent the past years working around open source communities and particularly international organizations and dev tool startups leading API integrations. But yeah, I'm excited to chat. I think 1 hour is definitely too small for the conversation today, but hopefully we could cover some ground, and I hope it's useful for anyone who cares about these topics. Over.
Great, thank you. I mean, I think for folks who probably are not on the call is recorded. Again, just disclosure again. So we're gonna have it on YouTube and probably share some snippets of that on LinkedIn as well, so people can actually just engage and get to learn. Thank you so much again, Balaji. Tosin, over to you.
All right, thank you. Glad to be here. My name is Tosin Felixson-Yusuf, lead engineer at Helium Health. I'm not an evangelist, so I may not be able to speak as much as Bolaji does. Like I'm just into the code, right? However, yeah, I know you said that Helium Health, largest funded company in Africa, but when we're in the weeds of the work, we don't really feel that way, right? But it's yeah, I'm glad. So I lead Helium Health. At Helium Health, we do a lot of healthcare interventions, build solutions, and also interact with government, private organizations, build solutions around healthcare, around the whole 9 years. We've been doing AI and all those things, right? And all of that, essentially, the implementation is a lot of team working together, from medical practitioners to product managers. So, but just the implementation is what the engineering does, and data. team, which I lead at Helium Health. That's pretty much.
Great, thank you. Thank you. So I think we're just gonna get straight into it. I think Bolaji, you're the first person I have the question for. Just on a general, for the public, most people that are probably on the call don't know what digital public goods are. And there are also words like things like global goods, right? Do you want to sort of like help on, create that, understand what a digital public good is, and probably a few examples from like Africa?
Yeah, I can do that. I'll probably start by saying you probably know what digital public goods are, you just don't know that you know. So if you have a road wherever you live, if there's a road network there, that's what we call a public good. It's a shared infrastructure. And it's based off the two main principles of non-excludability and non-rivalry. So that basically means you can't stop someone else from taking the solution. And if someone takes from the road, it doesn't take away from you. So it's a shared public good in that sense. And so when it comes to digital public goods, the difference there is the digital, right? And we do have like a general definition of how we define that. It's a term that already existed many years before now, but in 2019, the UN Secretary General, defined it as open software, open data, open AI systems, open standards, and open content that adhere to privacy and other applicable laws and do no harm, by design. And so basically what this means is that there are certain solutions we call open source. I'm sure most of you are familiar with that already. And this basically means that those solutions adhere to the four freedoms of open source. So the right to use, to modify, to reuse, and to study. And so basically any solution that has a license that adheres to those four freedoms generally considered open source. That's what open source is. But DPGs go a step further, and I often like to call it open source plus plus. And so what that basically means is that every DPG is an open source solution, but not all open source solutions are DPGs. And so by that, I mean, these solutions are designed in some extra ways. And one of such is that they help advance the UN SDGs. Secondly, they also adhere to certain privacy and applicable laws. And so this is, of course, also regional. If it's EU-based, for example, it could be GDPR. In the African region, we also have different national laws and also different best practices in terms of how that works. And then there's also the privacy part, which is in terms of like how it's more or less how the solution is designed. So you're handling PI data, for example. How do you handle that, data? What data do you collect, for example? Are you collecting enough information you need to run the solution? If you're collecting information, how are you securing the information? So everything around that aspect also is very key. And then the fact that the solution does no harm by design. And so it basically means what mechanisms have you designed into the solution. So take, for example, if your solution collects content, be it text, and you distribute that to different users via the solution. How do you protect people from harm, from illicit content, from harassment, different aspects in terms of how the solution is safe? And so in summary, the idea behind this is that it changes how we think about developing solutions beyond just writing code, building data sets or content collections, and more around how have we designed it in a way that it's usable for the public good so it could be reused. And that's the main core is that these solutions are being reused really. It's why we're caring about privacy. It's why you're caring about the laws that bound how you actually design the solution. So someone in Nairobi could take a solution built in Rwanda and reuse that and also adapt it based on their own local context. It's kind of like the idea. It's like building goods that people could reuse. It's why when you go out on your road, you have different types of cars driving on it. It's not just sedans, you have SUVs, you have trucks and bikes, right? So that's the basic idea. It's not just a road for, I mean, in some countries, you do have roads for specific vehicles. That's another kind of solution in that sense, right? But here you have public goods that could be reused based on different contexts. I could ride my bicycle on the road and ride my car also on the road. And yeah, that's it basically. Try and stop here. I could go a minute talking
Great,
about this, but yeah.
great. Yeah, I mean, you didn't, I'm not sure if you did mention the examples of digital public goods
Oh
in Africa.
yes. Yes.
Yeah.
We do have a couple, but thinking also in the African region and more also even in the health space, we have community health toolkits. It's a framework that enables you to build digital health apps. It enables the healthcare workers and also help them provide the solutions. So it's actually the kind of solution where you could take that and also build different kinds of things out of that. We do have Shahidi. It's an open data crowdsourcing platform. Enables people also to analyze that. That's also African. We have a few others. There's OpenFN. You mentioned that earlier. You're dealing in terms of like workflow automation. We have Bisa Health. There's Moduloop in terms of payments. There are quite a lot of them based
Great.
on different sectors, the health sector, the payment sector, and all of these solutions fit into what I just described, and they're all solving different social problems, be it for GovTech or just being generally for different aspects of the community.
Great, thank you. Tosin, I think this is for you, and I'm asking this particularly because Balaji just sort of explained, what digital public goods are. But from your experience, I'm very sure that from time to time you get to make decisions on which sort of solutions to adopt or to integrate with at Helium. How do you decide on say open source solutions? Does it really matter when you're making a decision in terms of integration and adoption for you?
Okay, yeah. So the decision to choose between open source and maybe any other kind of solution, it largely depends on a lot of things. If I go down to those things, we will spend the whole day. However, I'll group them into like four, right? So pretty much you can't do without open source because like most of the best tools are open source, right? Yeah, most of them, right? So it's just the way the way the workflow works, right? And I'll explain why it seems that way. I think when you look at it, it's simple. Look at open source and say that and see it in a way like say open source actually set the standards that everyone else follows. That's what it is. I'll give you an example. In the past, I used to be like a JS analyst and I transitioned into a JS developer. The major tools we used there was like ArcGIS. I know you remember that, right?
Yeah.
So ArcGIS, it has this polished field. You could run almost any analysis you want to straight out of the box. But down the line, there was actually an open source version, which is QGIS. The problem then was QGIS didn't measure up to ArcGIS in terms of functionality, ease of use, and it was actually launched way behind ArcGIS. So any serious company were actually using ArcGIS, which is like bespoke for specific use case, which is the GIS analysis. But because it's a communal building framework, the community were contributing, and what was missing was actually being contributed to. Within a few years, it actually closed the feature gap, and then um, the outcome is that the formats that the QGIS is actually built in was adopted everywhere because the way these systems talk to each other can only be done via a standardized, not from an organization that has decided its own standards. So a standardized platform by which contributors can actually communicate with each other. So they create that standard. And at the end of the day, because of the adoption and the communal feel of the software, Azure itself has to support those standards that QGIS actually provided. So if I push it down to like healthcare, we also have like that is what we do. We build custom EHR solutions. That's like our major product at Helium Health. However, there are actually open source substitutes to that. There's OpenMRS. There are a lot of open source EHR systems. However, open source EHR systems have like this interoperability built in from the ground up. Like you have the fire standards and all those things. They're actually built in from the ground up. And they have to do that because those standards are the way by which people contribute to the system. And for those systems to be able to interpret with uh, other systems, right? They need to follow some specific framework. We're also seeing like the open approach to AI, right? So when you look at things like MedGemma, which is like a model built by Google, medical based model, it is actually open source. However, there are a lot of things to it. It's actually built in a way that you can use it within small scopes. There's the 4B version, there's the 24B version. So the small scoped version, which is very 12B, can even be installed on on your mobile phones and things like that. So there are different variations to this, and this is because of when something is open, it's targeting larger group of people as opposed to targeting like specific class of people. So now going straight to my response to what you did ask. Before I adopt a solution, I think of scope, right? Just as I explained with those examples, open source solutions are broad scoped, while bespoke ones are actually targeted at your use case. So if you want to build out a solution and you require this thing, you require these specific use cases. I mean, open source require you to do a lot of things to get it working. However, there are bespoke solutions that are targeted directly to that thing. So if the scope can allow for me to work with something that is broad scope, yeah, open source all the way. Then security, there's a lot of open source has a bad rep around security, right? People say, oh, it's not really secure and things like that. However, the difference is that open source allows you to configure your in-house infrastructure security and how you interact with it. But then you have to do more work to ensure that there are no backdoors because it is community focused and anybody can contribute to it, even though there are controls. However, the standards of those controls, you also need to check that out and do your own due diligence before incorporating that into your system. Then cost, if cost is, that is a no-brainer. If cost is what you're considering, open source, of course, is what you should use. And then just what you manage in terms of scope and then the things you need to do. If cost is a major thing that is in your control, like if cost is what you're considering, then open source is the best thing, right? Most startups actually do open source because they don't have enough capital to run things
Fantastic.
around
So
that.
yeah, so makes sense. If I would sort of like summarize that, that would be on first cost for you. Or let's say you start with scale, the scope of your work, making sure that if the scope of your work allows you to be broad enough or bring something that is broad, which can then leave you at the risk of being verbose somewhat, then you can do that. Second would be security, and then the third is sort of like cost for you, pretty much. Is that right?
Yeah,
So would
yeah,
you
you got it.
just to make just sort of like a quick one. Do you, for instance, use any open source AI model today within the scope of your work? Would you adopt that? Or how do you see that today?
So I like the way models are. So you have open weights, which is not open source, right? I don't really think there are much open source models that give you access to that data. That won't. I don't know. Like DPG is here, but probably that might not even be ethical for you to expose data like that, right? But essentially, open weights, we use a lot of those, like the mention I mentioned. However, it might actually get more expensive for you to do that than to use a wrapper around, say, OpenAI or Claude or something like that. But it depends on your use case.
Great, great. Yeah, that makes sense. Balaji, I'll just come back to you. And this is very important to me, around, DPG in Africa. I like to always tell my story from like a healthcare use case, and I sort of like paint a picture. The typical hospital in a place like Nigeria is owned by one doctor. So virtually every hospital you find is owned by an individual person, which then means that you don't have any hospital group that has up to 50 facilities in their network. And the effect or consequence of that would be for you to sell 50 EMRs, Tosin's EMRs, for instance, to 50 hospitals, you have to have 50 conversations, right? Which means you need to hire salespeople that you have to pay market rate at very least. And then compared to how much is going to then take you to how much you're going to make back from selling those EMRs, to a very small facility that clearly does need this solution. Now, off the top of my mind, it would be like, yeah, this is a no-brainer opportunity you know, um, for what's the name for DPGs or open source solutions to come into the space. But then we know there are opportunities. I mean, there's OpenMRS, there's BAMNI, and the likes. What, from your own perspective, what opportunities do you think exist, and how would like a typical, DPG startup or a proprietary software that is considered to become a DPG sort of go about it, trying to target this sort of people as well?
Yeah, no, that's helpful. Thanks, Ayodele. And maybe just to piggyback on what Tosin said about AI systems, I'm glad you mentioned open weights because you rarely find people, use the right terminologies for that. Well, you're completely right. We have very less open AI systems. We actually do have a thinking around how we talk about open AI systems. I just put a link in the chat there. But yeah, there's a lot of work into trying to ensure. There's a reason why you have less of those kinds of AI systems with the data sets available, but there's more work on that front, and we do have actually a couple solutions in the pipeline around that. But to your question, Ayodele, so Tosin already began to help me answer some of this already earlier when you mentioned like QGIS, you mentioned as one of the solutions you mentioned, all of which are DPGs, now. And the way I like to think about this, it's first you have a network, right? So the DPG ecosystem it's not just based in one country or one continent. It's a global, international ecosystem. And we have solutions being built across different geographical, regions, solutions with also different expertise, different skills, different sizes, right? And there's just a lot that can happen in that, connections, like what you mentioned in terms of the Nigerian, the hospital situation. There is so much that all the different hospitals are doing, and also very much different stuff that the hospitals are doing. And there's so much you could leverage in terms of how you work with those people in that network. And so the first thing I always tell people when it comes to like those opportunities is the community. It's actually how you get to grow the solution, right? Because if we did have a maturity assessment framework, kind of what Tosin was saying earlier about, scope and scale and size, different solutions will be on different rankings, which we do have now. So some solutions could be like 9/10, some could be 2/10. And the goal is always how can we get those who are 9/10, to leverage the experience, or rather, get those who are 2/10 to leverage the experience of those who are 9/10. And there's a lot that goes up, goes on there because you have access to these people. Say, for example, we do have like very large, you probably go to like Wikipedia on the content side. We have like Ghost, CMS, you mentioned OpenMRS already on the health side. We have DHIS2, for example. And DHIS2, for example, has a lot of like HSMA networks across the world. And so these are like huge and very successful digital public goods that actually have gone the path that you're trying to go. And it's always easier to leverage, wisdom from how they've done all of this thing. So there's like the opportunities for partnerships there with those kinds of solutions. There's opportunities for knowledge sharing. And more importantly, also you get to work together, right? Tosin mentioned interoperability already earlier, and there's a role standards play in terms of how open source solutions work together. It makes it easier for you to adopt multiple solutions because of how you could exchange data between them. And so in a scenario where you are aligned with different, other solutions, you actually get to work together in terms of procurement. I would find it easier to adopt 3 solutions together because they're connected and they serve a purpose for me together. So for example, you have OpenFN on the data exchange layer, and then I have OpenMRS solving one problem. I have CHT solving another problem, DHIS2 solving another problem, Kobo Toolbox, helping me collect that data and analyzing that with OpenX, and all of these different solutions, are connected in a way that you could use them. And in some sense, that's what digital public infrastructure would mean when it comes to like the government side, how you use the solutions at once. So the earlier you're able to build these alliances with these solutions, it's always easier. You're trying to ensure that your solution speaks well with them. You could exchange data. It makes it easier for people to adopt. So that starts on the community side because that's the main, it helps you improve your project. It also helps you with more chances of being procured, based on the ability for your solution to grow. And on the other side, there's the more general visibility you get from being a recognized digital public good. As I mentioned earlier, there is the DPGA, it's an alliance. It's an alliance of different like country members, NGOs, CSOs, and different stakeholders. And the role the alliance plays itself is actually to accelerate the adoption and discovery of the solution. So there's a lot of work that goes into like advocacy, visibility, policy work, and being part of that network helps a lot. I did share a link earlier, for example, which is the registry where you find all those solutions. And I I promise you, different countries work with these solutions. Different stakeholders work to both support them, to implement them. There's a lot of capacity building going on, especially even in the African region where we're actually implementing the solutions ourselves, as well as also having third-party system integrators help with those implementation. So there's all of that, and that eventually would lead you down to the front of year, securing some form of funding, securing some form of partnership, securing some form of like growth of the solution. And in the end, of course, the main reason why the solution exists will only continue to grow as a result of that synergy. And I'll just start by saying, I mean, the real benefits of DPGs generally is that there's so much we could do together than we could do alone. There's just there's a lot of like building happening. I mean, I've spent years also working in the open source ecosystem, and developers love to build stuff. They're always building and building. There's so many frameworks, so many libraries, and we keep doing tons of that. And meanwhile, there are more problems to be solved. So it's more of a world where you're having less of building the same thing over and over again, and more of relying on what exists and extending that forward. So I don't have to build from scratch anymore now. I take what already exists, build on top of that, and then advance my work. So you can see how that connection also strengthens everything, because there's a lot of like benefits that come both ways in that sense. So I think those are kind of the opportunities in terms of like partnerships, the collaboration that exists, and of course, potential visibility and opportunities that come from the global community beyond the African region. But of course, it starts Africa-wise, and then we do have, for example, a couple African countries as members who also use these solutions. Nigeria, for example, is a member, and there's also what's the word? Malawi and a couple other African countries. They are also using the solutions and continuing to evolve on the general landscape for their own national countries, and also reusing across different African countries, and also even from the global community. But yeah, those are some of like my initial thoughts.
Great. I'm just going to buttress your point a little bit because, I mean, as a product person, when you were saying something, I think one thing that sort of occurred to me is that being a DPG probably lets you focus more as a product team. So your product focus is not about just going and becoming wider, but you can actually solve a problem with depth. So for instance, I don't have to build the new interoperability layer for OpenMRS because now I can leverage Open Function to connect to about maybe 50 plus different software. But then also there's the opportunity that, because someone else have tried a use case and see how we work in a different country, it's easy for them to also then trust and adopt our solution, like in a new setting. But the question I'm going to ask you is, from your experience, would you say that, governments and nonprofits, for instance, across the world, are do you think they are beginning to favor more open source and digital public goods? And maybe this is going to lead you to talk a little bit about 15.5. I know that was not part of the plan, but it's something
Yeah.
that just occurred to me. Yeah.
No, definitely. I would say yes. I mean, it's the work we are also doing and supporting like countries to do. I mean, we do have a lot of different countries also who have like open source as part of their procurement policy, like prioritize open source. Some countries don't have that yet, but it's a work in progress. There are a lot of case studies in different countries that have implemented different open source and digital public goods. Modulo, for example, has been used in Liberia. There are also different countries that have used them. OpenFN, of course, obviously we have OpenCIBS, which is being used in Nigeria and also in other
Mhm.
African countries. The list is on and on. DHIS2 obviously is used in Nigeria also and many other contexts. So governments see the value already, right? It's not, I mean, I like what Tosin was saying earlier about, there are always those myths, security is a problem. The best thing is to close it in the box. And there's never been a solution that grew just from being closed in the box. There's so much that comes out from that. And there's actually a study that the Harvard Business School did on the economic power of open source software. And of course, it gives you the framing that it would take many teams like 3.5 times more to build the solutions that they run on top of. So pretty much every infrastructure in the world runs on open source one way or the other. If you take out all of them, then we would have a world with less, digital transformation in that sense. And it will cost you more, basically, to run this. So it's like what you're saying Ayodele, that these solutions exist, you could build on top of them. If you take out all the main, infrastructure, we had, even for Helium Health, for example, as you mentioned earlier, to do part of what they are doing, because they also rely on some of this infrastructure in that sense. So it's proven statistics-wise that, these things, solve some economic problem. And that's why, of course, governments will continue to use that because it only helps them provide public services even faster. So yeah, there are tons of use cases, research also happy to share with anyone, particularly even in the health sector.
Great. Yeah, the links you've shared will be added to the description of the of the video when we upload to YouTube later. But yeah, thank you very much for that. Bolaji. Maybe later on there's probably going to be a conversation around how to become a DPG outside just opening your code base to the world on GitHub. Great. So the next question. So this is for both of you. Really. And we live in a world where vibe coding is one of the most popular words now, right? And I was saying, a few days ago that in the past it used to just be proprietary and, and or open source. And bigger organizations would say, you know what, let us create a small team to build the software internally, right? But these days, you might as well just decide to use AI to build something, right? As much as possible. Now, and that then now comes to the conversation around open source solutions, especially for like things like enterprise SaaS, which is one of these use cases. If you move away from like, the architecture level. How do you think about, intellectual property for businesses, right? And how does being open source, for instance, protect that? Or being a DPG protects like your intellectual property, or does that not necessarily matter in this case? Tosin, Bolaji, this is all for the two of you.
Yeah. Because you mentioned the PG, I assume that was for
Yeah, and open source as well. Like, if you're building an open source solution, from your experience,
yeah.
where do you
Okay.
think intellectual property play in that entire role, plays a role, and how do you manage that? Because I think that is considered a moat for most, startups,
Yeah.
right? My
All
code
right.
is my intellectual property. And what is your advice in this regard?
All right. I think this is wrapping a lot of things to one. Let me just start by explaining what I understand. First is the fact that the open source thing, right? I think let's just clarify, almost 80% of what we use in building software is open source. Whether we like it or not. It's like your
Yeah.
program language is open source. A lot of those things are open source. Yeah, like nobody pays for JavaScript. Nobody pay for React. That's just how it functions. However, you're very correct in terms of when we work with organizations, like they are very enterprise scale organizations who have been married to specific processes and software that they find it quite difficult to break out of those and integrate something that probably is open source and there's no control, there's nobody to hold responsible for all that. And yeah, like I can give you an example. Like we worked with a company in the energy sector. I won't be able to mention the name, and very conservative. Like they use Microsoft Stack and they stick to it. So we just wanted to deploy something like Docker, right, to Dockerize some of their system, and they were opposed to that because it is not part of the Microsoft stack and it is not proprietary. They actually have this rule that everything must be proprietary that they will use, nothing like open source. So basically, yeah, the reason why they do this is very clear. They are bothered about data privacy and security, which is part of what they do. They have bespoke things they're working on, and they don't want that exposed. And they feel like adopting open source means you have to open up your environment to those things. However, adopting open source does not mean like if I use open source solution doesn't mean my solution is open source, right? That should also be clear. And then again, when you're looking at contributing to the community environment, it also helps you economically because it opens up your own market. It makes people use what you have and yeah, adaptability to your system, especially in the community essentially. And I also like to think of we are all software engineer, but what we're actually building is not software, it's a business, right? Your moat is not your software. Software is just a tool that help you get to that. And the tools you use, like, of course, there are some things that are very peculiar to organizations that you have to keep them within them, but then whatever you use that you know can benefit the environment, that also adapts, allows your own solutions to be used more. I think it benefits more for you to have more communal participation, expose the IP, make sure that people can contribute to it and use it beyond what you think you can do, right? So yeah, I don't know if I did answer your question, but I tried
Yeah,
to answer all the
yeah, I
points you
think
created.
you did mention an important point, which sounds very VC-esque around, your software is not your business, right? So making your software open doesn't necessarily mean that your business is open, so to say. Yeah, Bolaji, but
Yeah,
I know this is also like a question you would have received a lot from from a lot of
yeah.
people considering DPG. How do you answer that?
Yeah, it's a lot. I try and compress it as much as possible. And Tosin already began to address that. So, I mean, as I mentioned earlier, there's a licensing aspect of the solution itself. Like open source doesn't mean your solution is public on GitHub. It means you have the right, license terms. And generally, we have two categories of licensing. There's the permissive licenses and copyleft licenses. And permissive, more or less, less stricter, which would mean that if I reuse your solution, I'm not mandated to share back based on the terms, and copyleft are more stronger in terms of like how you are expected. So if you're reusing that solution to to give another business to do something on top of that, you're mandated to like give some rights and all of that. So that's one layer, which is to ensure you have the right license terms. It's a business, as Tosin mentioned, so you don't want to start something based on all the different licensing also have different areas that they focus on. There's the two cultures of license I always recommend to people to like kind of understand, like, to the point of scope Tosin was mentioning earlier. What exactly are you trying to solve? What problem are you trying to solve? If you're trying to build something where you really just want everyone to take it and continue to build stuff on it, just go the permissive route, of course, and then find more ways to like ensure the business strives. So there's that part. Figure out your scope, your target audience, where you're trying to solve, get the right license, and then ensure you have that. We often call this like commercial open source, which is like figuring out how do I build the business around this. And it starts from, of course, relationships, because to be very fair and honest with everyone, when you have the right license terms, you actually you can control how people use the solution, first of all. So it's one differentiator between proprietary solutions and open source solution. Like you don't have that power in that sense based on the license terms that you have used, right? It's the reason why we have licenses now we call source available licenses to try to restrict access in terms of like commercial usage. If you're trying to build a business out of a solution, they try to they you won't be allowed to do that, basically. I'll just put it like that, right? And we say those kinds of licenses go against the four freedoms, and it doesn't enable the kind of innovation that open source should have in that sense. And it's not everything needs to be open source. I always like saying that also, and not everything needs to be DPGs also, right? There might be scenarios where you need to make something proprietary, and that's fine. It's all about how do we compose these solutions together. For a country trying to reuse and build something, they would always have a mix of proprietary, open source, and public builds in that combo. And of course, the world will be even way much better as more as we have those kinds of open source solutions being used. So licensing, figure that out well. And there's also the trademark aspect. Ensure you have the right trademarks. Ensure your community knows how you want your name and branding to be used, because there's ability. Of course, it's public, so anyone could take what you've built and redo something else based off that, and you can't do much in that sense. So there's trademark, and there's a whole bunch of lists. I would also put a link to a playbook that I often also recommend. And then there's a governance aspect also of your solution. It's not just something you just it depends on the size, obviously. Also, if you're building something that already has some traction and you're aiming for some impact, you need to have like a governance model. How do we manage this? It needs to be beyond you. There's supposed to be like some kind of framework around that. Some DPGs would have like a foundation manage them in terms of the governance. You have like the Linux Foundation, some have their own internal foundations, some would probably have like a steering committee, they would have a committee of practice. There are different models on how you manage that. That helps strengthen the product innovation and how you're moving forward. Because at the end of the day, it's all about the relationships you have with the people who can actually pay for these things. Even though it's open, we have different models like there's a base solution which is open source, and then you provide like a hosted service on top of it, like the SaaS model. And then of course, people who want more hosted services pay for that version, and of course, the free one is still available. Some would do like SLAs, for example, have like implementation tariffs for the government, the different models basically on how to like manage that business side. And the earlier you begin to think about that, the better, because many years before now, DPGs used to be mostly like grant funded, and only until like last year, for example, did it become very clear that it's not a reliable model to have just that. We still need grants obviously to run this. That's why you have like the blended finance model that kind of balances both sides. But you need to have grant funding and also be able to diversify your funding, because what happens when the grants stop and you're not able to sustain that aspect of your solution. So there's all of that, trademark licensing, the governance. CLA is also very important, because you're not only dealing with those who are consuming the solution, dealing with those who are contributing also, like what terms do you give to your contributors to understand how their contributions are also being used, right? There has to be clarity on that also. Basically also, MOUs, agreements, just learning how to, handle that commercial. It might mean hiring someone, of course, who has this expertise to like help you work around that without infringing on the openness of the solution, but yeah, building on top of that, how can I build the right relationships? Enough that even if we have DPGs that are being used by big tech, also large companies that could have just gone ahead and rebuilt the entire thing, but there isn't much so incentives also for them to do that when there's like good relationships in terms of that. So yeah, I'll put a link to a playbook which I think also covers a bit more like the commercial aspects.
Great.
Some things you could do on that.
Fantastic. Thank you. Tosin, and thank you very much, Bolaji, for that. I think at the end was still, the last question is for you. So, yeah, and it talks a little bit about some of the sustainability models. And I think that's going to be important, especially like, for health techs in Africa who basically may have received investor funding or not, but then also are considering how do I make enough money, to sustain myself and the product in itself. But yeah, before we get to that, please, if you have any questions, please feel free to add them in the chat. We're running towards the end of the panel, and we'll see how many questions we can take if there are any. Then, Tosin, the question, and you did mention earlier about the case of an organization, refusing an open source solution in their stack. I'm just curious to know if you've had the reverse of that, situation where an organization is actually refusing to adopt like a proprietary solution, and or they have some drawbacks around, proprietary, and would rather, you know, allow you deploy something that is open source as part of what you're doing for them.
Yeah, definitely. But mostly around, I guess, mostly around people who are evangelists of open source solution, who wants to actually make things more mainstay, right? So I've had people actually, we've had clients that have requested for us to deploy OpenMRS rather than a bespoke solution because they want us to push out the open source version, and also the benefits that provides for you, the communal improvements that it provides, the interoperability that is out of the blocks, and the fact that it's a system that everybody understands. Yeah. So in those cases, that there's the other side of it, beyond just
Yeah, yeah,
requesting
but
for.
I find that very interesting considering that you have your own bespoke EMR platform that is probably considered one of the best around, and then having like a client saying, you know what, forget your software and then give us this open source thing, and just deploy it and help us manage integration. That's great to know. Thank you. Yeah, Bolaji, I think I saw someone raise their hand. I want to sort of give them the chance and allow Balaji to end with the sustainability question eventually. I think it was that Hefiri. Just making sure I'm getting the right person. Hi, Efiri. Yeah. Do you have a question?
Yes, I do have a question. I'll just wait for you to call me up when
Oh,
I'm
great.
up.
Yeah, you can ask your question now. Do you mind introducing yourself? If you are, your company, or your products, and then the question you have.
Okay, so before I introduce myself, I want to say a very big thank you, Ayodele, for putting this webinar together. This has been the most engaging digital health um,
Right.
webinar I've ever been involved with. I'm a medical doctor, but also a digital health specialist currently practicing in Bayelsa State at the Federal Medical Center in Egua. But then I also work as a digital health specialist with the Bayelsa Medical University, leading a telemedicine product that has AI clinical decision support that we're deploying currently. I'm also trying to champion a product for pharmacy, and then the patient component would be for drug reminder. I'm very, very interested in research, health, health tech research for interventions for patients to help drug policies, a whole lot interested in that. So that's a bit about me. I'm really excited about this topic because prior to this conversation, I've just learned about public digital health course, and I've been having to like think about how to proceed from there. And miraculously, we're having this conversation now. So thank you so much for the engaging insights. I can't get your name right. The
That would be
Helium
Balaji.
Health. Yes, I
Yeah.
have questions for both of you. And then at the end, I'll just give you my thoughts. So I heard you mention, sorry, the digital health um, frameworks, because part of what I was really confused around is what programming languages do they use for this? How do I proceed to actually like using them if I want? That's one for you. And then the next question is something Mr. Ayodele had already talked on about how people would want to become a digital health, a public digital goods ambassador in the like. In Bayelsa State where I am, we're currently using DHIS2. That's the only public digital health good I'm aware the Ministry of Health uses. And then something you also mentioned, Mr. Ayodele, I see that we need a bit of a bit clarity on it because I'm just like imagining I have lots of imagination because I just do a bit of coding with Python. So I'm also like anti-gravity. Can I just like give the prompt, tell it to just customize it, all of those stuff? Those are things I'd want to experiment on. And then I think I have a question for the Helium said
Sorry,
again.
Efiri, I think there are like four questions now.
Yeah,
Just to make sure we can sort of like we're clear. Do you want to sort of like list out those questions again so we can
okay, how do I would love to become like what's the roadmap to become a public digital health goods advocate? You know, you talked about vibe coding. Like, how do I like? Can I just use anti-gravity to integrate into these modules? And then, what's the other question again? I was not even writing down. I was also interested in the frameworks, just like Ayodele also said about like each of them has their own customizable frameworks. And then someone gave a very, very awesome definition. I think it's Ayodele. He mentioned how the new definition of digital health goods covers like open AI, open this. And then as a follow-up, the engineering lead of Helium was talking about open MedGamma in healthcare. I just basically, like you said, this webinar cannot cover all of the interest point, but I really want to learn more and the awareness to more involvement. And this is not a question, but I really, really am interested in research. So if you are like looking out to do research publications around digital health, I'm really, really interested in being a part of it. So those are my questions, and thank you for this really, really engaging and insightful webinar.
great, thank you. Balaji, do you want to go first on that?
Yeah,
On
just
on
to start
advocacy.
quickly.
Yeah.
Well, I actually wasn't even thinking of that, but so I think you were asking. First of all, thank you very much, Afiri, for the questions. I think you were asking some questions around the customizing aspect of these solutions. So I think first you're going to have to figure out which of the solutions are most relevant to your scope and like narrowing on that. All the different solutions, of course, have different like components. And the programming language determines how far you're going to that. I think OpenMRS is Java based, for example. Others have different bases. So you narrow in on the few of the solutions, and then you narrow in also like the programming languages. Then you narrow into like the community. You mentioned DHIS2 already, and they have different HISP networks across the globe. And I'm glad you mentioned they're already there. So that's kind of like the pathway for like specific solutions. Try not to over-index on too many things. It's more so, I mean, you mentioned a medical doctor. So what's the primary focus for the hospital you're trying to solve a problem for? If you have the AMR, what else do you need? Figure out solutions that fit into that and just narrow into becoming good at implementing them. And then, everything, takes up from there. And that's also the same answer for advocacy, because it's pretty much like what I really was saying earlier around speaking to different hospitals. If you already have a framework in your mind on how you will do that based on previous experience, you've implemented XYZ solutions, you've implemented both open source solutions, proprietary solutions, you have an understanding of how all of them work together. It's not just a story of, let it just strictly be open source. If that happens, that's good. How do you combine that together? When do I use one over the other? Once you get that framework, you just begin to do that, obviously, where you are, the hospital you work. You have colleagues, you have friends, you tell them the story, obviously. And you mentioned research already also. So you write, you write research from your experience on what you've done, so others could learn and also implement that in their own hospitals. Same way, for example, Helium Health would, have case studies on how they've implemented XYZ solution in XYZ, state, and the impact that it has had. So it's all about starting small. It's the small, threads that connect the bigger picture in terms of the advocacy aspect. So be close to the communities, building the solutions in summary. But yeah, I'm over to you, Ayodele and Tosin.
Great. Yeah, I think on the advocacy part, I like to say that we're all advocates of open source. But then again, I think different products have different product communities, right? So there is Open Function has the community, Medic has community. So I think one of the key things that makes open source work is the community as well. So the way really is to find the solutions you are excited about, maybe the ones you use, participate in the communities, get involved, tell more people about them, write about them, as much as possible. I think, Bolaji has experience being an advocate for a while, before his current evangelist, career. But, so again, but really the way to be an advocate is, just talk about the things you're excited about the product, and participate in the community. Tosin, do you have any piece to talk about with respect to the questions or something?
Yeah, here we go. So, first is like, I think most of it has been covered. I know there was a question. Can you remind me of the question that was directed at me precisely around MedChamber or something?
What you said about MedGamma.
Okay, what was the question?
You just said something about like Bolaji said open AI, and you were talking about MedGamma in your own presentation. MedGamma.
Okay, yeah. So I explained that there are two classes of ways you can use models, right? And I was actually talking about it in terms of cost rather than because they are not open source models, they're just open weights. So what happens is when depending on for instance, Media actually handles medical, we use a lot of that. However, when you look at the cost it takes for you to host that, it's quite expensive. You have to have GPUs, you have to have all those things for you to be able to use it commercially. So you have to get like a minimum use case where you can balance your cost with your request. That's when you can verify that, okay, this is actually profitable for me. But in terms of when your use case is lower, then evidently you might have to go proprietary. You have to use the APIs or things like that, unless you want to train your model and you have the capital to host it. So it was just a conversation around what I was trying to say.
Great. Thank you. Last question is for Balaji. Number one, how do we become DPGs?
Yeah, sorry. Apologies for
Okay, no
interrupting.
worries.
I want to correct something. You say like, oh, Helium Health is actually we build EMRs and we are not selling other software before
Yeah,
before I
definitely.
get fired.
No worries. Yeah, yeah.
Yeah.
I'm
So
very, I'm very.
the tools we use is like we are actually out for something which is to digitize healthcare. However, we do that, we use whatever tools that is available to help us do that. It doesn't have to be what we built, it has to be what gets work done. That's actually what matters to us. All
Right.
right.
Right,
Yeah,
great.
over
Thank
to
you.
your last question.
Thanks for that. Yeah, and now I'm happy that your job is secure. Um, Great. So Bolaji, first, how do we become, DPGs? Like you said, making your code open doesn't being open source doesn't mean you're a DPG. So, how do we become a DPG? And then secondly, like, what does sustainability look like? Do you have example of companies that are doing really well, from a sustainability standpoint? Or given that a Nigerian startup trying to give their, for instance, their EMR, right, to the government or to a non-profit to use, what sort of approaches can they take or what opportunities exist from like a sustainability standpoint? I think if we can round that up, I think that would be the last question.
Yeah, thank you, Ayodele. I think I already began to answer the second part
Mhm.
before now. So maybe on the process for application. So we do have a DPG standard, which is kind of how we operationalize the definition I mentioned earlier. And so the standard has multiple indicators around different aspects, from open licensing to platform independence to clear ownership to privacy and security, down to mechanisms for extracting data. So all of those indicators kind of like specify what is the expectation, and then you have to provide, you basically answer for a couple questions, provide some answers, some evidences, and then we assess, the application also based on the answers you provide. I'll put a link in the chat to the DPG wiki, which is kind of like the comprehensive guide on what that would look like. There's a portal, there's a form, you apply, and then we assess and then provide you with feedback. If there's need for clarifications, we ask, and then once you're accepted, you then become part of the DPG community and benefit from everything else that I have shared. In some scenarios, some solutions are not eligible, but the process of the application helps them rethink how they design. So first, it even helps them just in terms of like the design, how design the solutions. So that's that on the application process. In terms of sustainability, I already spoke about that in the previous question, but it's two fronts. Of course, you're sustaining the people behind the solution and also like the solution itself. So that requires money, requires structures, it requires time, right? And it all boils down to everything I've said around, building the right structures first. What's the licensing structure, what's the governance structure. You need to have all of those in place first, and then from there begin to build around that. What's the business model of the solution? What's the source of funding? It's similar also to even how VC funding work for proprietary startups. No VC would give you money without also saying some, there's some due diligence that needs to be done. What's the valuation? What's the impact? What have you already done now? So you need to already begin to do that. What have you already done now? How are you communicating your value, the value proposition of your solution? Also in terms of like the scope of what you're doing, what's the impact there? You need to be good at, communicating all of that. And then it goes then next into like building the right strategies. There are different strategies, depends on who your target audience are also on, if you're selling to governments, for example, there's I mentioned already SLAs, I mentioned like implementation tariffs, providing support for implementation. That's one way also, of course, that you get income back into the solution, providing hosted services on top of the solution, trainings. There are different ways. If your solution also involves like some hardware, in some cases, especially in the health sector, you might have that. There's also tariffs that come from the hardware. You could already even begin to provide your own hardware, in terms of hardware in addition to the software that is already, open source. So in summary, I would say you need to do a lot of research to figure out all I just said, and then you plan, and then you measure and you iterate, kind of like the agile process of building the solutions. You kind of take that, and of course, communities exist for this, as we've already mentioned. There's an entire DPG community to help you through this process. DPGs are heavily thinking about these topics. We actually do have a research we published recently on this topic. I'll put a link also in the chat. It's good if you're just building something, it's very good to think about this fresh first, because the challenge most DPGs have now is that they thought less about this. They relied so heavily on grant funding, and now they're working their way back. And we've had good cases of DPGs who have actually begun to solve that problem, like Decidim, for example, that have diversified their funding. I'll try and find one link for Decidim and also share just for anyone who's watching much later. So at the end of the day, you leverage the community you have and try to learn from what everyone else are doing in terms of like ensuring they could sustain the solutions themselves. The key is to ensure, of course, that you could run everything you need to run the solution. The people behind the solutions, you could actually continue to run your infrastructure. There's salaries you need to pay. Also, there's improvement for the solution, because that's another problem. Sometimes we solve the people side, you pay salaries, you run the infrastructure, but you don't continue to improve the solution. And you also need, money and structures for that also. How do I continue to evolve? We've talked about AI, for example, and AI landscape increases a lot of stuff, causes also more problems. How do you continue to add in your code? How do you continue to add more features? How do you continue to improve existing features? All of those things are also part of like where this kind of partnerships come in. So working closely with your community, also with different partnering organizations are always very helpful for this kind of topics. But yeah, I think I'll just stop there so I don't take much time.
Great. That's super useful. Thank you again for the links. Like I mentioned, I'll make sure all the links are available for anyone who is interested in having them after now. Thank you. Is there any other question from anyone? I know we've got a few people on the call, or contributions. Anyone that probably has implemented DPG or has experience implementing DPG in an African setting and feels like, adding to the meat of the conversation, please feel free to indicate. But in the absence of none, I'd say again, thank you so ever so much, Balaji. Thank you very much, Tosin. It was such a great conversation. And looking forward to the fruits of this conversation, as you'd say. And yeah, thank you. Thank you. I hope it was also useful for you, as panelists sharing from your wealth of knowledge and experience. Thank you very much. Again, to everyone that has joined, thank you. We've just had about 8 people total on the call. I would open up like a breakout room. Or if you're comfortable, I'm gonna stop recording now. And if you're comfortable and you just feel like, just chatting, please feel free to hang around maybe for 5 minutes and meet someone in any of the breakout rooms. So I'll just create a breakout room now, and you can join or leave afterwards. So you just create like 2. And yeah, and everybody can get into it as much as possible. I think you'll be invited now, and you can choose to join anyone yourself, if you don't mind. I'm joining room 2. So thank you very much, guys. Thank you again, and have a very good time.